So this is going to be a relatively short lecture. I've been lecturing to you all a lot, and I want to give you a bit of a break as well. And that being said, this is going to build on a little bit more on applied anthropology, specifically work that is being done at USF, for instance, but also more broadly as well. I have partners in health here, and they are an organization co-founded by Paul Farmer, an anthropologist I've mentioned before, and I'll mention later on in this presentation as well. But I mentioned partners in health because they're a great way to sort of say, what can anthropology bring to the table in terms of health as an issue in particular of note for me as a medical anthropologist and also Paul Farmer for the same reasons. So Partners in Health basically started off in collaboration with Paul Farmer and other health researchers and local community members in Haiti, as an example, sort of where this really started to take ground. And they were big on promoting what's called community health workers, basically getting members of the community involved in taking care of their own health and finding ways to get around the larger power structures and systems that really limit your ability to have a lot of agency in terms of your own health. So these community health workers can be, for instance, trained to be able to administer vaccines, to hand out public health information. Basically, they can be almost a support staff, but also a very integral member of the healthcare infrastructure and support team, really, on a given topic, especially when the anthropologist leaves the field. There has been a lot of discourse on how a lot of community members get kind of annoyed by anthropologists and other sciences as well, including in public health or sociology, for basically going into a community, doing research, and then leaving, and not really giving anything back that can be, for instance, used by the community members over time. Nothing tangible that they get basically out of the research. It's more of a give and less of a take in terms of their perspective, in terms of what anthropologists or other scientists sometimes bring in terms of their research. Now, it's one thing, for instance, to come up with, let's say, a short summary of your research and give it back to community members, but even that is oftentimes not done either. They just basically were researched on and not researched with. And by that distinction, I mean you can have a lot more engaged role when you're an anthropologist or a researcher in a community and not just be this sort of outsider researcher kind of standing from back and looking inwards. So there are different ways to do this, and that gets to the engaged public anthropology discussion that we had on Monday as well. But also keep in mind that it is also important to sort of conceptualize before you even go into the field what you are trying to accomplish and what you want to give back to community members. Daniel Lindy, he's an anthropologist in my department, he said that really to do a good applied project, you need to make it applied from the get-go. And by that, he means you can't just tack on at the very end of your project, okay, I'll give them something. Make it an active process. Ask them what they want. So for instance, when I'm in the field and I'm thinking about ways that I can maybe give back to the communities that I'm getting a lot of research out of, I'll say, hey, is there anything that you really want or you think would be useful for my research? So for instance, I would hand short summary reports to the doctors that I talked to because that's what they wanted. Another doctor wanted PowerPoints that he could show to, for instance, other members of the community when he is treating them, to talk about dengue fever as an example. And these are ways that the community members and participants of your research see that you care, and also that you see this as a partnership and not just me getting something from you as a researcher. So keep that in mind, and again, I'm trying to keep this short, so I'll stop talking here. So I hope you find this article really interesting because actually it is written by members of my department, including graduate students in my cohort, as well as professors, most notably Dr. Dylan Mahoney and Dr. Bear, who are both good examples of anthropologists who have their hands in many pots. So for instance, Dylan Mahoney is a economic anthropologist, linguistic anthropologist. He's starting to dabble in nutrition now because of Dr. Bear's work. And this is an important context because as researchers dealing with human populations, you can't just isolate certain aspects and study them and expect to have any clear or real results, because humans, again, are multifaceted and there's different needs and concerns on a daily basis for many people, and you can't just, for instance, look at nutrition and expect to understand the health of a community, such as this study found. So, as I have typed out here, a team of anthropologists went to do a nutritional assessment of Congolese refugees. So, an assessment for nutrition can take multiple forms. It could be something as simple as a survey saying, for instance, have you accessed clean and healthy foods in the past 6 months. There's different scales for this, for instance, as well as doing what are more called biometrics, so actually taking measurements. So for instance, taking calipers and seeing your levels of body fat in certain spots, but I think they were more doing the more qualitative aspect of this in this research, as far as my understanding of it goes from talking with them personally. So, as I say, we need to be able to adapt on the fly. And when you are, for instance, doing field work, when you were doing your personal observation, I'm sure it was a little awkward at first because people, A, don't expect you to be a researcher out in the field when they're, for instance, enjoying their time on the beach, but that's the reality of the kind of work we have to do. And on that note, in terms of expectations, the needs of refugees are actually very multifaceted just because A, they're humans, and B, they're in a very different context than they are used to or maybe even want to be in, as they must navigate multiple structural and social barriers in a very new context as it is described, with a large amount of spoken and unspoken rules, laws, and social norms. So you may remember a video I showed you at the very beginning of the semester where refugees came into the United States and they were told, for instance, not to walk in groups because it was making the shop owners concerned, while in their culture it was the norm to walk around in large groups. Additionally, the man on the airplane, not knowing that, for instance, we consider mustard to be a condiment, and he was using it as something just like as a food stuff that I just eat, for instance. So those little things that we just take for granted are very alien for someone that's not used to that. And when you're dealing with the bureaucracy that the refugees need to when they're coming into the United States, it's easy to see how they can get easily confused, lost, or fall through the cracks. So I'm going to highlight here one aspect of this article that I think really encapsulates a lot of what I've been talking about this semester. In particular, how you can't disentangle politics, economics, and culture from health concerns. So, for instance, it is the expectation of the US government that by the 6-month mark, meaning a refugee who has been in the US for 6 months, they will have acculturated enough to gain sustainable employment and income. Notice the word here, acculturated. I'm assuming this was a strategically used word by the anthropologist here to get at something that is more nuanced than saying, for instance, were they able to find gainful employment? Because in the US, to gain gainful employment, you must be able to, for instance, get to the work in the first place. For instance, knowing how to interpret the road signs, having a vehicle or finding some means of transportation, being able to communicate effectively, most likely in English, because that's what most work is going to require them to be able to do. And often these refugees also have to take sort of acculturation classes, basically crash courses in being a member of the US populace, where they're also crash coursed in English. So imagine you are trying to find gainful employment, you are trying to make sure that your family has adequate nutrition, while at the same time you're having to learn about the US Constitution, you're having to learn English. This is a lot for refugees to do in a very short period of time, and many refugees fall through the cracks because this is, for many, insurmountable or very difficult to do, especially when they're having to juggle other responsibilities. So, let's just say this family was able to, for instance, find gainful employment. After the 6-month window, there is no guarantee that they will receive any further services from refugee resettlement programs. So for instance, let's say you were able to find a job in the service industry, While before your income and your food was being supplemented by these refugee resettlement programs, now you're having to support your entire family on a minimum wage job. This is hard for anyone, especially for someone that's a refugee, but of course it's hard for someone that's working and is a member of the US society. So imagine how it is for them also too. Now, on that note, it's something simply, in our mind, simple as buying food actually can be quite complicated given this scenario. So for instance, if they can't afford to buy nutritional food for their entire family, they may need to rely on food assistance programs. So for instance, WIC in Florida is often utilized in this context. Now, to access WIC or other food assistance services, you often need to be quite computer literate, as well as be able to navigate the different bureaucracies that can, for instance, give you the ability to access food stamps or get a WIC card to buy food for your family. So you have a refugee who maybe doesn't speak great English. They could speak great English, but they're still going to have multiple barriers. So for instance, being able to even get to the work sites or go to the food assistance program facility to be able to employ themselves or enroll themselves. And you can see how this can be really complicated and have other consequences, not just economically and physically in terms of their physical health, but also mentally, as they're having to deal with, for instance, racialized stigma when trying to access gainful employment, from them feeling socially isolated because no one is from their culture around them. Maybe they can't find access to the foods they once were accustomed to, which can also have implications for nutrition, because it has been found that nutritional choice, so preference for foods, has a big influence on a person's ability to cook for themselves and provide for their family. If you're used to eating rice and lentils for every meal, but you live in a food desert that only has really access to, for instance, McDonald's or Burger King, this is going to rapidly change your diet, and you can undergo quickly what we've talked about in this class as a nutritional transition from eating more traditional foods to having a very Western-centric, high-caloric diet, which can be a risk factor for a variety of different health consequences, including obesity and diabetes, for instance. And also it could change their capacity for infectious diseases. As your diet changes, also your immune system does the same thing. And if you no longer are eating a nutritious meal, this could weaken your immune system and increase your ability to contract infectious diseases, as well as increase your risk for chronic diseases as you're eating a poor diet also. So, applied anthropologists are often working with communities, but also sometimes for certain organizations. Again, anthropologists often fall into the cultural broker role. Oftentimes we give this to ourselves, which can get complicated when different stakeholders, so members of your research community, for instance, when they have different opinions about each other and your work. So I have two quotes here that sort of summarize this. The first, the anthropologists were in an ideal place to facilitate the communication, but it had to be cognizant of the obligations to both communities, so the refugee programs and also the refugees themselves. As they go further on to say, the trust both communities had for the anthropological team was critical in addressing two final issues the Congolese community brought to the anthropologist. So let's unpack this. An anthropologist serving the role of the cultural broker, again, as I talked about on Monday, is basically trying to be the mediator, the go-between two different, or maybe even more than two different stakeholders. And again, the stakeholder is basically just someone that's important in the context of your research. So the anthropologists are basically researching the refugees, but also we end up often researching those we are even working for in the process, maybe even without even trying to do so, because it helps us to understand the context there, to get that deep, thick description we talked about at the beginning of the semester. So, as they're trying to service the refugees, again talking about capacity building also, they realized that the refugee services themselves may not be doing the best job at their job due to a miscommunication between the refugees and the resettlement programs. This is not to say you need to entirely blame the refugee services themselves, but also there's blame on both sides, and there can be something that can be done on both sides as well to have a better conclusion, to find a solution and move forward. That's the role of an anthropologist, trying to be the cultural broker. Not everyone's going to be happy with the final result, most likely, but like in politics, compromises are made, and you, as being enculturated in both of these communities over time, have a good understanding of what each party needs in that negotiation process, which is why it's important to have a researcher doing this sort of work so that there is not a failure of communication, which can lead to gridlock. So, for instance, in politics, or nothing getting done as a result of this gridlock. So, building trust is a key component of being an anthropologist, because without that trust, for instance, let's say you are taking the side of the refugees entirely, you may end up alienating their refugee programs, and nothing ends up getting done, and you may have actually done more harm than good. So this is a really complicated job, and it's really easy to do it bad. So it's important for us to have a good understanding of ethics as well as the context of the research we're doing. So that's why it's also important to do a literature review and have a good idea of what to expect when you enter the field, because you need to be able to adapt to changes both in the personalities of those you're interacting with, because not everyone gets along with each other, and find ways to compromise and move forward. This is, again, really complicated, but also it's a rich area for research, and there could always be more done in this regard, which is why it is important to stress that applied anthropology actually is a growing field, because there is so much room for us to be able to serve in different capacities in different communities. So switching over to the other short article I sent you all for today, I'm going to be talking about collaborative research and how it's different than more traditional work in that a lot of power is in the hands of participants. So I used photo voice on Monday as an example, which means giving participants cameras and telling them to find issues of concern in their community. Collaborative filmmaking is similar to this in that you're not necessarily dictating what someone should be talking about like in an interview setting. So I'm going to basically give you an example of this, and then we can move on. So if I'm in an interview and I have a script to follow, I'd say I have 10 questions I need the person to be able to answer. That's what we're going to be talking about in the interview. That's the structure of it. That structure is useful when you're trying to, for instance, find a lot of individuals who are saying the same thing, but also it can be constraining because you are, in a sense, leading participants in a certain direction. So if you're talking about Zika and Belize, you may not be talking about their nutritional intake in the past couple of weeks due to their job closing down shops. So that may be of greater concern for them than talking about Zika. But since your project is related to Zika virus, that's what they're going to be talking about, because that's the sort of questions that you're going to be asking. In a collaborative model, you may have an idea of what the participants are going to do, but it's a lot more back and forth. It's discursive. There's some dialogue there, and participants can continually surprise you and take your research in a very different direction than you had expected, which is sort of the point of doing this sort of work. So in photo voice, if I'm again looking at what I think to be a concern in the community, let's take litter as an example. I give everyone a camera and say, take a picture of concern in your community. I'm expecting to get a lot of pictures of litter, but for instance, what if they all take photos of the police station because they think that the police is corrupt? That's interesting, and it's something that I wouldn't have found if I didn't give them the tools to tell the story they wanted to tell. That's sort of the point of doing this sort of work. It's messy in the sense that it's not in a structured interview setting. You don't have a lot of power to really dictate what's happening, but that also could potentially lead to less bias because you are not leading them down a certain direction. This is very I would say it's a more recent direction in research, and not everyone is on board with this sort of work, but collaborative research also is a great tool if you want to build community trust. So if communities have experience with researchers going in there, doing surveys, giving them questionnaires, and interviewing them without getting anything out of it, they may be less inclined to do so in the future. However, if you are working with them, for instance, on a collaborative media project about their local community that gives them something at the end, the video, for instance, they may be more inclined to work with you and also other researchers in the future. So it's a way to also build capacity in terms of research as well as for the community so they have a tangible product at the end of your work. Like the previous article on refugee resettlement, the anthropologist had to navigate a difficult scenario of multiple stakeholders having conflicting opinions. So, for instance, when a member of the community expressed that he felt some of the white residents had a superiority complex because of where they decided to live, this created some tension because many, or at least multiple residents, felt like this was directed towards them or did not reflect their community dynamics in the way that they felt was reality. However, because this was not decided on a sort of everyone raise their hand and vote scenario, there was a lot of nuance here that could be explored by the anthropologist. So, as she's going to each person, each stakeholder, and asking their opinion about whether this should be taken for granted or taken out entirely from the documentary, this was a great opportunity for her to see that this sort of idyllic racial harmony manifesto that this community had may not actually entirely reflect reality, if there is such a thing called reality. And additionally, this was a great opportunity and is a great way of expressing that more equitable and true descriptions in our work are really only gotten when we really engage with the community. Because, as I've already mentioned, if you are letting the community sort of guide the research as you're going along, you may be doing a better job of not letting your bias be inserted in your research. So collaborative research is a way to limit bias because you actually are getting what community members are talking about. And in a sense, it is more democratic because you are not the sole researcher dictating the sort of agenda of your work. Again, this is hard, and these conflicts and tensions can be very problematic as a researcher. So, for instance, when I'm doing work in Belize, I know that one of the doctors in the island where I do work at and a pharmacist there do not like each other. However, they do know that I often speak with the other person, so I'm sure they probably think that I'm relaying what they're saying to the other person. I'm not, but I still need to be diplomatic because I don't want to potentially burn any bridges, especially since there's only 2 doctors on the island. So if I were to, as an example, speak ill of the doctor and he were to find out, I may lose one of the 2 doctors on the island as a contact, effectively cutting off 50% of my overall pool of participants that are doctors on the island. This would be very problematic and raise a lot of questions on whether or not what I'm seeing in terms of Zika virus or dengue virus, whatever I'm looking at, is in fact what's actually going on, because I've lost half my participants that are doctors on the island. However, because I realized and experienced this tension, I was able to see there's another dynamic here. So if the pharmacist and doctor don't like each other, what ends up happening is they're not communicating with each other. And in an instance of an epidemic disease such as Zika in the community, if 2 healthcare workers are not talking with each other, this is a potential barrier to service provision, as the doctor is not getting, for instance, invited to the health fair that the pharmacist is hosting. The pharmacist claims that they don't involve the private clinic doctor because he's a private clinic doctor, meaning he gets paid for his services. And the health fair the pharmacist provides is free health care for Keykalker residents. However, when I talked to the doctor, he felt that he was being singled out by the pharmacist, and effectively cut out of servicing the community because the pharmacists did not like him. So we have a disconnect here between the motivations, or at least the perceptions of the motivations of these two parties, which ends up manifesting in one of them not attending this health fair, which is reducing the amount of access to free health services that the island has. And since this event is only held once a year, the private clinic doctor being effectively cut out of it, he's not able to provide free health services to community members in this platform. So there's less equitable health care going around. I mention this because I'm trying to segue into the last slide concerning Paul Farmer again, who I've mentioned multiple times in this class, because I want you to think about how tensions and conflicts can play out in politics and economics. And for instance, what we're seeing right now with Jane Castor, our mayor, pitching the idea of doing a shelter-at-home declaration, despite the board of directors essentially in Tampa saying she didn't have authority to do so. So keep an eye out for this developing context, because it shows again how you can't separate politics, economics, culture, and people just being people being irrational animals that don't always make the decisions that we expect them to. Because if we don't keep that in mind as researchers, we're going to be doing a poor job of really understanding that true description of the people that we're studying. So the last slide. As you all know, because I've shown multiple clips of him, I'm a pretty big fan of Paul Farmer, and I think you should be as well. But I'm going to revisit him here because A, he's an anthropologist of infectious diseases like myself, but also he's a doctor. So his experience as being an applied researcher, a physician, helps him sort of see issues in a different light, on the ground, as it were. So it's one thing to write about infectious diseases, but it's another thing to treat them also. And since Paul Farmer works in international contexts, so for instance in Haiti and Venezuela, he often sees how structural factors can influence the spread of infectious diseases. And these are largely as a result or a product of state governments doing a poor job of taking care of the health of those most vulnerable. As Paul Farmer and others, including myself, have argued, it's really impossible to control the spread of a disease if you don't understand how structural factors and cultural factors can intersect with each other to exacerbate negative health consequences for those at most high rates of exposure and risk, most often the poorest members of society. So I'm going to have you watch basically an interview of Paul Farmer, which is sort of a afterwards discussion of a documentary he had shown. If you have the time, I definitely would look for the documentary, but since it's not free, I'm not going to assign it to you because it's not fair for you all. But to sort of think about what he's speaking of in terms of coronavirus. He mentioned Zika and Ebola, the two most recent, probably in our minds, infectious diseases that reached epidemic or pandemic status. And this is before coronavirus concerns. But what he is saying, especially around the 10-minute mark, definitely applies to what we're seeing now. And how if we don't have a concerted efforts at multiple levels of society, from the individual to the state government or the federal government, it's going to be really hard to control for this disease. Now, like Paul Farmer, many anthropologists at the time also were saying that Ebola is not really going to have a very strong foothold in the US because there's this mentality that if a very strong infectious disease does come over here, we are going to spend a lot of resources to control it. So taking the Zika example, Florida spent a lot of resources and the CDC spent a lot of resources making sure that areas were properly fumigated so that this disease would not spread, especially in Miami, which is a big port of entry where a lot of infectious diseases actually come from. However, because coronavirus is often asymptomatic and be spread very rapidly, it's really hard for us to control for this disease. So we cannot be, I don't want to say nonchalant as we were with Ebola, because Ebola is a very big health concern. But we need to find different ways of conceptualizing how we're going to deal with coronavirus, such as what we're doing right now with social distancing and personal isolation, avoiding vulnerable communities, avoiding public spaces, shutting down restaurants in response to infectious diseases. This is all very new for us in the United States, and it comes to a big surprise for a lot of us also. But not saying that all of us are in the same boat, but it also speaks to the level of privilege that the United States has, where people are able to, for instance, isolate themselves. But again, the most poor members of society, who, for instance, are working in the service industry, may not be able to afford to not go to work, or they may be end up getting fired because there's no one utilizing restaurants, as an example. So what do we do in such contexts? And again, seeing as we live in this sort of neoliberal capitalist society where a lot of our worth, our self-worth, and our healthcare system is operated around us being able to afford services, we can definitely see the disparities that have always been there exacerbated to different levels, and it is more visible in our society also. So please watch this short, relatively short at least, video. And again, stay safe, and I will talk to you all via PowerPoint next week.